Hey. Hey, wake up or you're going to be late again.
Just a few more minutes. What time is it?
Well, see for yourself.
Oh my God. I'm going to be late for work. Why didn't you wake me up?
Well, that's what I am doing.
Juliet is going to have me for dinner. That woman is never happy unless everyone else is miserable.
All right, hurry up then. I'll pack for you lunch, eh?
Habarigani?
Yes, Korean, what does it mean?
Good morning? No, wait. I know what it means. It's, how are you?
Yes, Habarigani means how are you?
I love speaking
And you're
Korean.
very good at it.
Huh?
You're very, very good. Let's go check those over here.
Cool, Miriam. Let's go see.
See what? What, Cody? What?
That man, they're making those toys. Come on. That one, that one.
Oh.
How much is it?
Hey, your lunch. I made it special.
Oh, baby, you shouldn't have. I would have just picked something up from the cafeteria. Plus, you should get some sleep after your night shift.
Hey, can't a man make his beautiful wife happy? You know, I want you to be happy and also be healthy. That way I can look like I am a good husband.
Well, all this is going to do is go straight to my hip.
Hey! Don't forget this again.
Oh, yeah, sorry. I never realized.
Have a good day and don't let those doctors drive you mad, eh?
You know they will. Yeah.
Okay, bye.
Bye, Mama. Your lunch, Mama.
Jackie Chakula, what's your problem? You just asked me for food.
No, Kashmani. My wife can cook anytime I want.
It's okay if you don't want.
Hey, wait. It's okay. I'm a bit hungry. Thank you. Buddy, honey.
Is this enough?
Oh, no, more. Well, thank you.
Oh, excuse me. Hi, I'm sorry. Do you work here? I'm looking for someone.
Huh?
I'm looking for Dr. One second, I can never get it.
Dr. Mugo.
Mugo, yes, thank you, Dr. Mugo. Could you point me in the direction of his office?
Yeah, sure. Just follow me. I'll show you.
Oh, great, thank you.
Cody! Oh, Cody. Oh, God. Oh, somebody. Oh, God.
I have to be upfront with you, Dr. Stewart. This is not going to be easy.
I am under no illusions, Dr. Mugo. None whatsoever.
You know, heading a trauma department in Chicago and one in Nairobi, two very different things.
I understand.
Do you? Do you really?
Dr. Mugo, I graduated in the top 10 percentile of my class, which so happened to be the Yale School of Medicine. I had my choice of hospitals for residency, but I opted for inner city Chicago because that's where my skill sets were needed.
I've read your CV and your credentials are undoubtedly impeccable. In fact, they played a huge role in you landing this job.
I have seen many cases. You know, I can cut up and stitch up as good, if not better, than the next trauma surgeon.
My point is that it is not going to be easy.
And my point is, I don't expect it to. But when it gets tough, and I know it will, I have what it takes to deal with it and make it work.
All right. That's what I like to hear. Welcome to St. Teresa's, Dr. Stewart.
Thank you.
Jackie? Really? Jackie, you're just gonna pass me like you don't even know me?
You should have called.
I should have called.
But you didn't.
But I didn't.
Why?
Wait a second. I'm sorry.
For what?
For not calling.
I asked you why.
I got busy.
You got busy. Really, Max, you got busy. Is that the best you can come up with?
But I did get busy. But it's true, I got busy. Hey, Sam.
Hey, Max. Max, have you seen this?
Yeah, fresh and neat. Can you believe that was us just last year? I mean, they have no idea the nightmare they're getting themselves into.
How many do you think will make it this time? 50%?
50? I doubt it. More like 10 or less. I mean, no one has the stomach to handle the awesome chief resident, His Highness Dr. Jackson, so...
You're right. Why is he so hard? I mean, you think he was born doing everything.
No.
Wasn't he an intern at some point too?
According to him, his gift of medicine was imparted by birth. Look out, here comes the Messiah himself.
Morning, Miss Juliet. Tell me you're going to have a wonderful day.
Oh no, nothing wonderful about today. Going by these admission sheets, everyone was either eating takataka or beating each other last night.
What we have is what, diarrhea and broken bones. Nothing like a triple bypass or aneurysm from one of my specialized skills.
Nope.
Well, you know what that means. Are these my latest victims? Wow, they look so young. Or is it just me who's growing old? Okay, listen up. Welcome to St. Teresa's Hospital. My name is Dr. Jackson Saba. I'm the chief resident here. I will be supervising your rotations. Now, probably the professors at the training college have promised you that if you walk around here, you might be rewarded with the letters MD added to your names and probably a fat bank account as well. Now, let me be the voice of reason here and tell you that out of this whole bunch, maybe just one of you might make it. You may think you have what it takes to be a medical doctor. You don't. I am quite willing to sit back and let you try and prove me wrong. But I am never wrong. The cream will rise to the top. Gather around for your assignments.
So this is the reception. Every single person who comes in the hospital must be checked in over here. It's really important. Over here we have the intensive care unit. This is where our serious cases of TB, malaria, cases like that, AIDS. This is where they're...
And who is that?
I don't know. I bumped into her in the morning when I came in. Sounds American, I think.
Millicent, I noticed that you came in late again. I need you to show some leadership. Set an example.
Sorry, Nurse Juliet. It won't happen again. I promise.
How many times have you told me?
Really, I promise.
Well, today there's a new girl coming in. Make sure that she's ready to start immediately. I have a feeling you're going to be on our feet all day again.
Doctors, Dr. Ofula, Dr. Suleiman, we have a lot to do, so let's get right to it. We sleep when we die. Yeah. Mrs. Maringa in number 4 needs a cretin count. Number 5, she needs a rectal for bleeding. Please give her a lower GI in case she has a CA of the bowel. And number 6, Number 6 is still waiting on her talk screen. Come on. Somebody needs to hurry those idiots in the lab. We need those results ASAP. What else? Okay, I think that's enough work for the two of you for the rest of the hour. Let's go. Have you been having any complications since last night?
Not yet.
Okay, we'll pass by later and check on you.
Your first patient in the list, Mr. Philip Were, came in complaining of chest pains.
Mr. Were, my name is Dr. Jackson Saba. We're going to take care of you. You'll be fine. Now just sit up, please. Where does it hurt?
My chest.
Okay, does it hurt when you breathe?
Yes.
On a scale of 1 to 10, 1 being low, 10 being high, how bad is the pain?
8.
Breathe in. Out. Good. Have you been coughing up blood?
This is one of our goals.
Okay. We're going to run some tests, but don't worry. You'll be all right. Let's go.
So this is the main exam area. You'll see everything here. Major injuries like amputations, broken bones, accident victims, burn patients. And then there are major surgeries like transplants, heart and brain surgery patients. Yeah, the works, just everything.
You two? You have nothing better to do other than stand there and stare?
And this is the nurse's station. It's a command central of the entire hospital. It's the nerve center. Everything and everyone comes through here.
Hello. My name is Dr. Jackson Saba, Chief Resident. But you can call me Jack.
Yes, this is our commanding general. Jack, this is Dr. Catherine Stewart. She's just joined us from Chicago. We're very lucky to have her.
Chicago. Very nice.
Yes, Dr. Stewart will be taking over as head of trauma. And I'm sure you and your staff will make her feel right at home.
Head of trauma, but Charles...
It's not the time. I have an appointment that I'm late for.
Well, Dr. Saba, I'm honored to work with you, and I think you...
Excuse me, please.
Am I missing something?
Charles, I was promised that position.
Nothing was promised to anyone. Look, if it were up to me, but it isn't. It was the hospital board's decision.
Then I want to appeal.
Don't be ridiculous, Jack. It'll never get through the appeals process. You know how long these things...
Good, Red. We have a high priority pediatric coming in. We need you at emergency.
This is not over.
Okay, Mrs. Murray. Hello, my name is Dr. Maxwell Ofula. I'm going to be treating you today. So, let me have a look. How did this happen?
I was opening a can and my hand slipped. Yeah, right. She was using a knife. I don't know how to use those can opener things you waste money on. Mom.
My mother doesn't trust those things either. It's a clean cut, so we should get it fixed quickly. Can you feel this?
Yes.
Okay. Move your fingers for me. Up. Okay, once more. Okay, good. There doesn't seem to be too much damage. We're going to give you a tetanus shot, clean it, sew it up, put you on some antibiotics.
Max, we have code red priority. Dr. Saba needs you.
Thanks, Milo. Mrs. Murray, this young man here is going to clean up your wound, get you a shot, and get you antibiotics. You should be just fine, okay?
Okay. Allah?
They called you in too.
Yeah, what's the big emergency? You think the president's on his way here?
You have a 10-year-old Caucasian male. Open traction, dislocation, right arm and leg. 1, 2, 3, 3. Breathing is stress, but manageable. Circulation, glow, 1840.
Give him 25 of Fent. We have a pre-op here. Notify the OR. The room staff. Notify vascular and orthopedic. Do you know his name?
This is Miriam, the nanny.
Hello, Miriam.
Hello.
What's the boy's name?
Cody.
Cody. Cody, can you hear me? My name is Dr. Jack. You're at the hospital. Yeah, and you're gonna be fine. You're gonna be just fine. Have you notified the parents?
I'm trying to reach his mother. Her phone is off.
Okay, just keep trying and don't worry. It's gonna be fine, okay?
Hi, I was just wondering if you could tell me what it meant. Fill in the main call phone number at the front desk. It's just a damn number. What's the big deal? Here, let me see. Thanks. I don't seem to be winning too many friends here today.
Don't worry about them. It's tradition. We're the newbies, so it's like a rite of passage. We have to figure things out on our own. This is a number. Just fill it in. It will probably change. I'm Laura, by the way.
Laura, sorry. Ines.
Eunice.
Thanks for your help, Laura. I'm Catherine. Dr. Catherine Stewart. I'm a trauma surgeon, the new trauma surgeon.
Trauma?
Wow. I need to drop this off at Dr. Mugo's office. Do you know which direction?
It's...
Laura, I need you on the floor. There is a priority case.
Hi.
Jeff! Jeff, I think that lady is trying to talk to you.
Many thanks, Jeff. You're my favorite nurse, you know, right? You take such good care of me. Everyone else around here behaves like I'm a bother to them when I come for my appointments.
Beyonce, I've told you 1,000 times, you don't need to do this test every week. Once every 2 or 3 months is enough.
But no, I've got... Ow! I've got to check. I don't want to fall sick, you know.
If you're using protection, you've got a better chance not to get sick.
Most of my clients, they're difficult. They don't like to use protection, you know. Anyway, I charge them more if they don't want to use a condom.
Look, I'm just saying be careful, okay? Insist on safety first, and that way you'll live longer and healthier.
Beyonce. Really, that's her name?
Yep,
And she does what for a living?
exactly what you think she does.
She's a prostitute.
Sometimes you do what you have to do to survive.
Miriam, what's going on? Is everything okay? Are you okay? Okay, calm down. What's going on? What's going on? Where's Cody?
I'm so sorry, my dog. I'm so sorry. I wasn't looking. The Cody was...
Where is my son?
The doctors, they're trying to help me.
Cody? Oh my God,
Ma'am,
Cody, what
excuse me,
happened?
ma'am. You're not allowed to be in here. You need to wait outside.
That's my son. Cody, what happened?
Millicent, can you go and take care of the lady? We need the doctor in here, not out there.
Okay? Your son will be okay.
Please,
You
God,
just
you have to let me in there. I have to
see.
see my son.
Ma'am, you need to let the doctors do their job.
Please, I need to see my son now.
Your son is going to be fine, but the doctors need to do their job.
Just listen to me, please. Just listen to me. I'm a doctor, okay? I'm the new head of trauma in this hospital, and I want to see my son now. Ask her if she knows I'm the new head of trauma in this hospital, and I want to see my son now.
Yes, but your insurance hasn't kicked in yet.
Insurance? What the hell does insurance have to do with any of this? I need to see my son.
Shall we all calm down now? Dr. Stewart, unfortunately you're not on duty, so I cannot let you in.
But doctor, that's my son.
Your son will be fine. He's stable. But you'll have to wait here until we're done. What's the rules?
Excuse me, nurse. And Nurse Laura.
Yes, may I help you?
Yes, you may help. I want to see a doctor. Actually, not me. It's my wife. She's not feeling well.
Okay, just fill this form.
Just a minute. Hello? Daniel? Okay, let me call you later. I'm in the hospital. No, I'm fine. It's my wife. Let me call you later, please. Yeah. What? Is that what they said?
Sir.
Really?
Sir.
Now tell them to forget it. My talents don't come cheap.
Excuse me.
Use the exact words. Okay. Yes, you were saying?
Just fill this form and a doctor will see you shortly.
Not shortly, but as soon as I finish filling this form, I want to see a doctor.
Everyone wants to see a doctor, but everyone must wait their turn.
Well, that's the difference though. I'm not everyone.
Hi, I'm Jeff. I'm a nurse. Sorry, I didn't mean to wake you up.
No, it's okay. I must have dozed off. How is he doing?
He's stable. No changes in his vitals.
Which means I have to be closely monitored. May I see his chart?
Well, there's no need to worry about that. We've got the best team of doctors here. He should be up and back to his cheeky self in no time.
Thanks. I'm Catherine Stewart, by the way.
I know. The new head of trauma from the States. Welcome to Nairobi, Dr. Stewart. I wish the circumstances were different.
It's my baptism by fire.
Well, from what I've heard of your exceptional work in Chicago, you should pass this test with flying colors. We're lucky to have you, Dr. Stewart. Welcome.
Thank you.
Hey, Jeff.
Hey.
How's the world of male nursing treating you nowadays?
Well, certainly not as good as the world of healing is treating you.
Yeah, Jeff, but all healers, yeah?
Yeah, well, this healer here can't afford a watch like the one you're wearing.
What, this thing? Nah, come on.
And I hear promotion is on the way.
Rumors, my friend. Those are rumors.
That's not what I heard. I mean, seriously, how did you manage to pull that off?
Not that I did anything. But Jeff, anything's possible. If you want something bad enough, you should be willing to do anything to get it. Even kill the competition.
If you say so.
I do.
Cody? Cody? Cody, can you hear me? Cody? 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 Oh my God. Code Blue! Code Blue! Someone get Parker now! Cody, come on, please. Come on, please, Cody. Excuse me. What's his pulse? Come on, someone tell me something. I need a heartbeat, please. Come on, you people.
What's happening here?
We had no pulse, but his blood pressure is...
What's the blood pressure?
Laura?
Come on. Come on, come on.
Okay, diastolic pressure is in the high 60s. And his heart rate is in the 30s, asymptomatic.
Thank you very much. You may leave the room. Please give him an injection of epinephrine. Everybody, please, let's focus.
Cody, come on, please wake up. Come on, honey, please. Come on, please, Cody. Come on.
We have rhythm.
Oh, thank God.
Really good work, but we're not yet out in the clear. I need him taken to radiology. We must find out exactly what has happened here. Thank you.
Dr. Sabat? Dr. Sabat?
I really don't have clear answers for you right now, Dr. Stewart.
Well, I'm a doctor. I think I have an idea of what's going on. It's just my views are not exactly objective.
Well, I think we have some internal bleeding. Most probably a bleeder from a joint fracture. We may not have caught all the leakage like we first thought.
Okay, so what's your line of attack?
Well, probably take him down to angiography and plug the bleeder under a real-time X-ray.
You can do that here. I mean, you have that type of equipment?
This is Nairobi, Dr. Stewart. Not some rural village in Angola where you foreign doctors are...
I'm sorry. I'm just a little surprised that you have this type of equipment. I wasn't...
This is the capital city of the largest economy in East Africa. Well, we might not be at the forefront in medicine like you in America, but in some ways, St. Teresa's is actually the best on the continent. This is the best place for your sick son to be right now.
I'm glad. That's great. Look, I meant no offense before. It's just been a very trying 24 hours.
No problem. No problem. I have surgery to prepare for soon. If you'll excuse me.
Okay.
Look, I'll be more than happy to be the judge on that TV show, but the price got to be right. You tell the producers of Kenya Superstar Search that if they want me as a judge on that show, then the number got to be right. 6 figure. It must be 6 figure. Yes, I'll throw in the band. You know, no one plays the trumpet like I do. Okay. Yes, you can.
Okay, Mrs. Wanderi. And I presume you're Mr. Wanderi?
Pastor James Wanderi. I shepherd the followers of God at the Heartbeat of God Church.
Oh, I'm sorry. Pastor Wanderi. Hello, I'm Dr. Ofula. So, what can I do for you today?
She fainted.
No, I did not faint, doctor. I felt a little lightheaded.
She fainted right in the middle of praise and worship. My wife here leads praise and worship like nobody can.
So, you said she fainted?
Yes, we are smack in the middle of singing God is so good. And I'm blowing that trumpet like it's my last day on earth. And the congregation is up singing and dancing. Then the Holy Spirit sets in. The heaven doors had opened.
And then?
Then she fainted.
Just like that?
Just like that.
Doctor, really, I'm okay. I just felt a little lightheaded, that's all.
No, she's not. You should have seen her right in the middle of the song. And bam, she fell on the floor.
He's making a big deal out of nothing. I just haven't had anything to eat. I'm praying and fasting.
Well, how about we verify that, okay?
I believe there are other patients who need your attention more than I do.
Everyone here is important. You included.
And you let the man do his job.
So, you said you were fasting. What are you fasting for?
I'm seeking God's guidance on how to be a better wife.
A what?
Better wife. Proverbs 31.
Verse 30. Charm is deceptive and beauty is fleeting. And a woman who fears the Lord is to be praised. My wife here is praying and fasting so that she can be a woman of noble character. Yes, you go tell your bosses that I know for a fact that Kenya Superstar Search makes a lot of money. And 100,000 is not too much to ask for. Yes, 100,000 per episode, nothing less. Yes, I will take nothing less than that. Yeah, yes.
So, it turns out you're going to be okay. You just needed some fluids to hydrate you, and now that we've done that, I'll get the nurse to get you something to eat.
No, I'm not eating.
But you have to. You're weak, and if you don't eat soon...
You don't understand, do you?
I do. You said you wanted to be a noble wife, a better wife, so you pray and you fast.
That is not what I want to be.
But I thought you said you wanted to be a better wife, so you pray and you fast.
What I want to be is a thinner wife.
A what?
A thinner wife.
Okay, now you've lost me.
Doctor, it's not easy being me. People look at me when I'm leading praise and worship, standing next to my husband, smiling, holding hands. They look at me and say, oh, she's so lucky. But it's not easy being me.
So you starve yourself?
I'm on a master cleanse diet.
Wait, a what?
A master cleanse diet. We don't take anything other than water, lemon, honey, and pepper.
How long?
10 days.
And you're on day?
Day 3. 7 to go. Amen. Doctor, you can judge me all you want, but I have to lose weight. If you saw those young women who come to my church, you would understand me. I'm not about to lose my husband to a 20-year-old student. No, it's not going to happen.
Good to go? Everything is fine?
Yeah, actually, I was just telling your wife.
Yeah, that I need to rest and take it easy, which I will do, I promise.
Yes, doctor. I'll make sure she has plenty of rest.
Yeah, you do that, Mr. Pastor, one day.
Thanks. So, what did he say?
So, are you going to sit back and let the American take your job?
I'm still chief resident the last time I checked.
Don't play games. This is me you're talking to. I know you've been campaigning for that head of trauma position since forever.
What if it wasn't meant to be?
You want me to believe that you're giving in without a fight? And to a foreign at that? I don't bite for a second.
You know, you amaze me. Just how well you know me.
You're an open book, my dear. You're not as hard to read as some here think.
Also not that hard to please.
You know what? Don't worry about the American. She won't last here 3 weeks. These foreigners never do anyway.
I think so.
Trust me, I know so. Just make her stay here as miserable as can be, and she'll be gone before you know it. That head of trauma position is yours. Get it back.
What would I do without you?
Not much.
What are you doing here?
Good morning to you too.
I asked, what are you doing here?
Do you really want to have this discussion here? No?
Good morning, doctor.
Morning to you. Can I help you?
Yes. I picked a card from over there and they told me to come this way to see a doctor. And you're the first one I've seen in uniform.
Max, what are you doing here?
You said the pain hasn't stopped for
3 days. It's hard to move. I can't even take care of my babies.
I need the whole 120,000 shillings. Then you can take the package.
What did you give him?
Oxycodone.
But this says that the patient is allergic to penicillin and hydrocodone. Why did you change his medication?
Selma, let's come to the ICU.
We have all kinds of irreversible damage to deal with. Patients have been known to lose their sight or part of their bodies through such careless mistakes.